السلام عليكم، أنا رغد نصار. بدي أحكي عن موضوع ال application of gold nanoparticles in cancer nanotechnology. بداية بدي أحكي بشو بنستخدم ال gold nano in cancer due to their unique properties such as absorption and scattering of electromagnetic radiation. فال gold nanoparticles are a particle interest for the application in photothermal therapy. وبتتضمن هاي الاستراتيجية إنه بنستخدم إشعاع المagnetic radiation to generate heat for thermal destruction of cancer cells. As we know, cancer is the third leading cause of death in developed countries and the second leading cause of death in the United. Nanotechnology هو مجال بحث لأكثر من تخصص وله إمكانيات كبيرة للكشف المبكر والتشخيص الدقيق والعلاج للسرطان. والنانو بارتيكلز عادة بتكون أصغر عن النانوميترز مقارنة بالبيولوجيكال موليكيولز مثل الإنزيمز وغيره. فبهذا البروجكت بالبرزنتيشن رح نحكي عن تايبس للسينثيسيس اوف جولد نانو بارتيكلز اللي هي اكثر من تايب اللي هي الجولد نانو سفيرز والجولد نانو روتس، جولد نانو شيلز، جولد نانو كيجز، SERs نانو بارتيكلز اللي هي surface enhanced Raman spectroscopy and الابليكيشن اوف نانو بارتيكلز. ورح نحكي عن البيوميديكال ابليكيشن اوف جولد نانو بارتيكلز اللي بتتضمن الان فيترو assays والسيلز اند فانتون ايميجينج وان فيفو ايميجينج والكانسر ثيرابي اند الدراج ديليفري. هاي صور هي many nanoparticles have been investigated for biomedical application targeting cancer. هلا في أكتر من نوع للسينثيسيس of gold nanoparticles based على السايز والشيب and physical properties. رح أحكي in details for each type لهاي السينثيسيس. First one ال gold nanospheres. ال gold nanospheres is also known as colloids gold. تعريفه هو small gold particles with a diameter of 1 to 100 nanometer which once disappeared in water. Well, most commonly used reducing agent is citrate. هلا the size of the citrates can be controlled by varying the citrate of the gold ratio. ولازم نعرف إنه the small amount of citrate will yield larger nanospheres. فهدول techniques of the two-phase method was later improved through the use of the phase transfer reagent. The size and shape للgold nanospheres could be readily controlled by tuning the synthesis parameters. تاني type اللي هو الgold nanorods. Beside the method mentioned in the paper, several other approaches have also been investigated for the fabrication of gold nanorods, including the bioreduction. Well, synthesis of gold nanorods has been reported using a wide variety of strategies. وكمان ال gold nanorods can be used to deliver drug molecules to cells, tissue or organs اللي رح نحكيها بالبيوميديكال application هلا بالسلايدات الجاي. ثالث تايب اللي هو ال gold nanoshells. ال gold nanoshells هو spherical particles consisting of a dielectric core surrounded by a thin metallic shell. It's most commonly gold. Also, it can be designed and fabricated with surface plasmon resonance peaks ranging. It has also been synthesized gold nanoparticle formation using thermosensitive core shell particles. This approach may potentially provide cores with a narrower side distribution and smaller diameters. The fourth type, gold nano cages, it's a hollow مجوف يعني porous gold nanoparticle ranging in size from 10 to over 150 nanometer. They are created by reacting silver nanoparticles with chloric acid in boiling water. The dimension and wall thickness of the resultant gold nano cages could be readily controlled to very high precision by adjusting the molar ratio of silver to this solution. The fifth type is SERS nanoparticles. It's an abbreviation of surface enhanced Raman spectroscopy, هو technique where molecules undergo much higher scattering efficient when adsorbed on metal colloidal nanoparticles or raw metal surface. والجولد للنانوسفيرز اللي هو بيكون 60 nanometer in a diameter were encoded with a Raman reporter and stabilized with a layer. وفي نوع تاني لل SERS nanoparticle تتكون من gold core اللي هو a Raman active molecular layer and a silica coating. And the last type is a application of nanoparticles. Now a simple search of nano would return more than 6,000 publications. In the biomedical application, nanoparticles are used, for example, for antimicrobial application, biosensing, imaging, and drug delivery إلى آخره. أما بالapplication للnanoparticles, there are few nanoparticle-based agents are in clinical testing or commercialized for cancer diagnosis or treatment, and most of them are based on liposomes which were developed several decades ago. هلأ خلصنا synthesis of cold nanoparticle types ورح أحكي عن ال biomedical application of gold nanoparticles. الكانسر nanotechnology هو منطقة متعددة التخصصات with broad potential application in fighting cancer, including molecular imaging, molecular diagnosis, targeting therapy, and bioinformatics. In vitro assays are designed with components of cells that have been isolated to monitor biochemical and functional reaction to determine mechanism of action and impact of novel therapeutics. Here, the National Cancer Institute Alliance for Nanotechnology in Cancer has required each of its funded centers to test their newly developed nanosensor using the same standard samples, which is expected to readily identify which new sensors truly stand out from the large pool of new molecular sensors. This picture is gold nanoparticles that have been modified with various molecules in vitro assays. Cell and phantom imaging. Imaging phantom, or simply phantom, is a specially designed object that is scanned or imaged in the field of medical imaging to evaluate or analyze and tune the performance of various imaging devices. Most imaging studies using gold nanoparticles were carried out in a cell culture. Also, the versatile optical properties of gold nanoparticles have enabled optical imaging of cells and phantoms with a wide variety of contrast mechanism. This is a picture of gold nanoparticles that have been investigated for cell and phantom imaging using various techniques. In vivo imaging in biomedical application is the non-invasive visualization of living organism for research or diagnostic purpose. Many paramagnetic nanoparticles have been used for magnetic resonance imaging both preclinically and clinically. Raman spectroscopy is the most promising imaging technique for gold nanoparticle-based contrast agent. Also, the Raman spectra and Raman images of methylene blue molecules adsorbed as a single layer on gold nanospheres were found useful for studying the plasmon properties. This is a multiplexed in vivo Raman imaging using SERS nanoparticles. In cancer therapy, most studies of gold nanoparticle-based cancer therapy have used photothermal therapy for the destruction of cancer cell or tumor tissue, which may be potentially useful in the clinical setting. Besides photothermal therapy, gold nanoparticles have also been investigated in other therapeutic studies. Although it was proposed that targeting the DNA of cancer cells with gold nanoparticles may offer a novel approach that is generally applicable to external beam radiotherapy treatments. Achieving DNA targeting in vivo is extremely difficult. The last one, before the last nanoparticle, here is a picture of gold nanoshell that can destroy cancer cells both in vitro and in vivo assay. The last one, the drug delivery. We know that we want to know that a nanotechnology drug delivery application occur through the use of designed nanomaterial as well as forming delivery system from nanoscale molecules such as liposomes and other nanoparticles are used in. So in a nanoparticle delivery system consisting of PEG coated gold nanoparticle loaded with TNF. TNF is a tumor nucleus factor, was constructed to maximize the tumor damage and minimize the systemic toxicity of TNF. At last, the nanoparticle conjugate has also used to destroy the tumor within an ice ball, again without significant systemic toxicity. At last, it has been almost 4 decades since the war on cancer was declared. It is now generally believed that personalized medicine is the future for cancer patient management. In this paper, we summarize the current state of the art of gold nanoparticles in biomedical application targeting cancer. Targeting lesions, imaging labels, therapeutic drugs, and other functionalities can all be integrated to allow for targeted molecular imaging and molecular therapy of cancer. Now, big strides have been made and many proof of principle studies have been successfully performed in this. And thank you for listening.